All right, think of a total addressable market of billions of people, and all those people who struggle with their weight and diet, to explain where the opportunity lies here in Australia and beyond. Allurion's Benoit Chardon is joining us now. Welcome. So, tell us what you're doing at Allurion. You have come up with a non-surgical device to help people suffering from obesity. Mm-hmm. What is the product?
We've been launching this product about 5 years ago now. We've been treating 100,000 patients. It's a very simple 10-minute walking procedure during which the patient can go into the practice, swallow a very simple capsule that looks like this one.
I might just get you to hold it a bit higher. Yep, okay.
It's linked to a catheter. Once the capsule is swallowed and in the stomach, we can inflate the capsule that will transform into a balloon that look like this one, a half-a-liter balloon. And the balloon will stay in the stomach for 4 months. During those 4 months, the patient will feel full, and therefore they will be doing a diet in a very simple manner. The innovation around this program is not only the balloon. The balloon is offered to the patient together with an app, a connected scale, a health tracker that enable the physician to track the progress of their patient. And the physicians have access to a software that enable them to manage the patient and offer best-in-class follow-up in order to lose 10 to 15% total body weight loss, so 10 to 15 kilograms in only 6 months. And what's really important about this program is that we take advantage of this honeymoon from hunger during 6 months to change the behaviors of the patient when it comes to eating behaviors. And we have done studies showing that 12 months after the end of the program, patients are maintaining 95% of their weight loss due to the quality of the follow-up that our clinics are offering.
Do they repeat the process after 6 months?
They could, but when you maintain your weight loss, the only reason to repeat the process if you want to lose incremental weight loss, which some patients do.
All right, so just in terms of commercialisation of the product, where are you at just as far as approval is concerned across the globe?
So we are available in 55 markets. We just pre-launched in Australia 1 year ago, and we are expecting approval in big markets like Brazil, China, and the US in the next 3 years.
Okay, so you have approval from the Therapeutics Goods Administration here in Australia?
Exactly. We pre-launched one year ago. We trained about 25 practices in Australia, and we already treated about 1,000 patients. And we are here this weekend to train 100 physicians to deliver best-in-class care.
Okay, so that's to your business plan then. So you need to actually get into various surgeries, clinics, to train practitioners to administer this.
Totally right. And you know, what's very unique about Allurion is how selective we are when it comes to clinics offering the program. Contrary to surgery or to medical weight loss, we're extremely selective about the clinics who can offer our program, because we know that there is a massive difference between a clinic who would offer the program without any care versus a clinic who will deliver best-in-class follow-up. So we only choose the clinics who have best-in-class nutritionists, psychologists, fitness coach, so that behind the software, behind the app, the patient is getting the real high-quality follow-up to change the behaviors during the 6 months program.
What is the cost to the patient, and what sort of margins are you looking at?
So for the patient, it varies between 6,000 to 8,000 Australian dollars, depending on the program that is offered by the clinic to the patient, depending on how many stakeholders involved. Half of this cost is the price of the actual device, and the other half is here to pay for all the healthcare professional supporting the patients during 6 months.
All right, I gather no reimbursements under Medicare, but is there an expectation perhaps that could change?
It could. It does require extensive pharmacoeconomic studies that we haven't been able to do for now, so it is a cash pay procedure.
All right, I mentioned at the top there the addressable market globally. What are you looking at?
So we've done a big market research on 10,000 consumers that tell us that 4.8% of the total population would be eligible and willing to pay for this procedure. So if you just look at Australia, that means 1 million Australians would have the right BMI and willing to pay for this kind of procedure. So it's a massive market opportunity. And if you look at another indicator that tells us how appealing our product is, if you look at the virality of our TikTok or Instagram post, we had a patient swallowing the capsule capsule on TikTok 2 weeks ago that reached 8 million views. So people are very curious and interested about innovation in the medical world for weight loss.
Are there any competitive products on the market?
We don't have any direct competition. There is no medical procedure that you can swallow with a simple glass of water that doesn't require endoscopy, anesthesia, or surgery. We're the only one.
And how well capitalised are you at the moment? What sort of backers? What are your investors at the moment?
So we've been, we're a private company. We've
Yep.
been fundraising $100 million since we started. And now we're looking at different options, whether it's staying private or IPO in the following few months.